Hello and welcome. I'm Dr. Liana Lianov. I'm the president and founder of the Global Positive Health Institute, and welcome to this GPHI podcast where we look at all things related to positive psychology, positive health, lifestyle medicine, and more. And today I'm delighted to have as a guest with us Matt Bloom. He is a well-being researcher and emeritus professor at the University of Notre Dame. Welcome, Matt.
Liana, thank you. It's a privilege to be here.
And you joined us recently, earlier this year, for the GPHI collaboration with the American College of Lifestyle Medicine on integrating meaning, purpose, and spirituality into lifestyle medicine, healthcare beyond, and that's how we connected. And I am now become a fan of your work, and so I look forward to digging in a little bit about this. So as we get started. This whole area is a somewhat neglected area of more conventional medicine. So I would love to hear what first caught your attention, grabbed your attention to how this is really important in health and medicine and healing.
Sure. Uh, if I could, I might just rewind a little bit and tell you about how in some ways, I kind of stumbled upon it. The research that I did, my team and I did for many years, was studying the well-being of people working in the helping and healing professions. So we studied international aid workers, global health workers. We worked with an agency that placed physicians in severely under-resourced contexts. We studied public school teachers and Christian clergy. And the reason social scientists often study what they consider more extreme contexts, the idea if you can, somewhat like studying elite athletes to learn how the normal folks should work out. We wanted to understand the well-being of these people who work in such difficult contexts.
Mm.
And I knew that there had been some research. We included domestic physicians, and I knew there had been some research, primarily at that time out of Mayo Clinic, Tate Shannon Felt and Lieselata Derby on physicians. But that had largely been, maybe exclusively, survey research, important. But what we wanted to do was to dig into the real lived experiences of physicians and to understand what's the difference between those who flourished over long periods of time and those who experienced severe declines in their well-being. Of course, physician burnout is an unfortunately well-known phenomenon. And so these four professions, which at first we thought were very different, and there were differences, but what was more striking was that the similarities across them. So one of those similarities was that these professionals experienced their work as deeply meaningful, and that deeply meaningful experience could either be the foundation for their sustained capacity to excel in their work, even in the face of severe work stressors and challenges. And I mean severe, like working in a war-torn country or serving patients in a village that was regularly under assault by warlords. So the deep meaning that some experienced was really the foundation of that capacity to excel over long periods of time. And for others, deeply meaningful work was a primary cause of the severe and chronic stress that they experienced and their eventual burnout that far too many of them suffered from. So deeply meaningful work mattered, sometimes in really important ways for the for positive ways, and sometimes in really important ways for the negative. So what was the difference? And what we found, or what I found, was that it was a deeply integrated spirituality that allowed this deeply meaningful work to be the wellspring of flourishing and resilience. Uh, and so that's when, I mean, I was a spiritual person. I grew up in a religious context. So it wasn't that I was unaware of this. It had been neglected by well-being researchers, but time and time and time again, what came up was that what I'm calling a deeply integrated spirituality was really probably the key, certainly one of the keys to doing well and flourishing. And if you'd like, I could say a little bit about what I mean by deeply integrated spirituality.
Well, please do. Go ahead.
Sure. So one is that it's a spirituality in which that person claims it themselves. Sometimes, particularly in religious context, the spirituality is more externalized. There's a set of rules and dogmas that the person tries to adhere to. By deeply integrated, it's one that the person embraces, that they've integrated into their life, into their sense of self. It gives shape to their worldviews. And so then it's fundamental to the way they think about their life, then the way they think about their work. Uh, It creates a moral framework, what we found for those who flourished, a moral framework that gave inspiration to the work that they did and the value that they wanted to provide to the people that they were working with. But it also allowed them to value their own well-being. Those that burned out, it was a kind of an either or, either I take care of myself or I take care of others. Those with a deeply integrated spirituality didn't suffer that conflict. They
Mm,
understood how their well-being and others' well-being both mattered. It provided, I'll call it the wisdom and the insights that they needed to make sense of the tragedies and difficulties in their work and to carry on and to remain committed to their work. And so it served as a continual source of insight into how to navigate difficulties, but also the inspiration for carrying on their work.
mhm,
So it was very much internalized, very much taken on to themselves.
mhm,
And that's, again, I think the key, but certainly one of the keys to how they continue to flourish.
mhm, mhm. Yeah, as you're speaking, the analogy that we have a little bit in lifestyle medicine is the when we have motivation to engage in certain healthy behaviors, there's the sort of the conscious, sort of separate, willful, I've got to do this, it's good for me, versus it's fully integrated and becomes basically a non-conscious part of who you are.
Yes, yes. The conscious part is the of the spirituality is understanding what they mean by spiritual. That they have a set of values that they live by, that
Yeah,
they have a sense of connection to, however they frame it, to God, to the infinite source of love, to something bigger than themselves.
yeah,
But quickly that becomes ineffable. They feel it, they claim it, they know it, but if you ask them to articulate it, they can only go so far. And then they regularly say something like, that's not the essence of it. It's like describing why you love someone. You can say a little bit and then you run out of words. So,
yeah.
yeah, that sense of knowing what matters, feeling that connection. And it was wonderful, particularly with physicians who would often characterize themselves as a scientist and somebody who valued science. But those with this integrated spirituality felt comfortable being able to claim that beyond which they could know, that sense of life or existence beyond what science could understand. And it was really remarkable because as a social scientist, I grapple with that. How can I articulate that I claim that there's this dimension, if you will, of life that is beyond science? The physicians with an integrated spirituality could deal with that, if you will, paradox or that sometimes attention and claim
Mhm.
it. Yeah.
Mhm. Wonderful. And what are some highlights of your work in terms of your been a researcher, the impact of this, or making this more, uh, at least increasing awareness, if not actual application of this in
Yeah.
healthcare and medicine?
Well, I'm always eager to find ways, and thank you for this opportunity to share a bit about what we've learned. Part of my journey was several years ago, I decided to leave my tenured position at Notre Dame and venture out into a place where I could be much more applied in my orientation.
Mm.
My university, wonderful as it was, wanted wants its professors to publish in academic journals, which is important. But a general audience doesn't read academic journals, and other scientists, physicians typically don't read social
Yeah.
science journals. And so I really wanted to find ways of applying that. So one is I'm a co-founder of a startup, Ritual. We have a mobile application that brings science-based well-being practices. I've got a book coming out next year on the science of well-being. So I'm looking for ways to take what I and this larger community of well-being researchers have discovered it and
Yeah.
translate it into understandings that we hope people can apply in their everyday
Yeah.
life. So one of the highlights for me was being able to be in the field or in a speaking to a group of physicians and share some of what we're learning and just see the ahas and the people leaning in and, oh my gosh, now I understand, or, oh, this is so helpful. That was really encouraging to see that it could be applied, could be
Yeah.
helpful. Yeah.
Yeah. And so, riffing off of that, if we have listeners who would like to expand their integration of this element of well-being into their clinical practices, their lifestyle medicine practices, what thoughts do you have there
Yeah.
that to make it easy, especially for busy practitioners who get it. They really get it, but they're like, okay, but practically speaking, how do I do this?
How do I do it? I've thought a lot about this in these professions, and so I hope what I have to offer is at least somewhat helpful. And Liana, I would say the best thing they can do is to develop their own spirituality. That the way we saw this at work, particularly with physicians, as a because that's what we're talking about, is it emerges organically. So rather than being a set of practices or techniques, it emerged out of their own spirituality in the context of working with a particular patient in a particular context. A quick example, a pulmonologist who had been practicing for 30 years before, at the time I talked to him, about 10 years before that, had joined a group. They called themselves the Med Poets. They were physicians who read William Carlos Williams and started exploring their own spirituality. And he told the story the day I first met with him. He had seen a patient that he had been seeing for 10 or 15 years and was giving she had COPD and some other complications, and was working with her, and turned around to write a note and heard her sigh. And he said, until I developed my spirituality, I wouldn't have paid attention to that sigh. And I somehow knew in that moment how to be present with her in a way that affirmed the sigh, and then more came out. So it was this sense of developing his own spiritual awareness that allowed him to bring that into his practice in a way that was idiosyncratic for that patient. And then he had a number of other examples of how it's meeting this human being in this particular moment and bringing that deep sense of, for him, one of his core values is loving and caring for others. To
Mhm.
be able to do that, and he talked about in years before, he tried to practice the techniques, listen attentively, look at your patients in the eyes. It wasn't authentic to him. Sometimes he said, I listened, or I looked at them so intently that it was off-putting. They're like, what the heck are you? But by, again, growing spiritually, he found a way to bring that into these unique contexts.
Mhm. So it steps away from sort of the nuts and bolts of medicine into, as you've eloquently said, something deeper. And it really can stick if it's something deeper within oneself that is then sensed and in relationship with another. And in fact, now we talk about person-centered care, but we talk about relationship-centered care. And so
Oh,
then
beautiful.
both individuals benefit.
Beautiful. Yeah,
Yeah.
recently I spoke with a physician that I've known for a while, and she's practiced for many, many years. And I raised this question, and she said, trust your spiritual instinct. And I thought, well, that's an interesting way of saying it. You have to develop that instinct, perhaps. But that was her. She said, I just trusted. I just trusted in this moment. Her spirituality is integrated with a religious tradition. So she gave voice to, I trust God, but she said, what I mean is I trust the depths of my spirituality to know what to do in this particular moment, which, yeah, sometimes it's just being there, you know.
Yeah. And any other insights or wisdom? I think you've been eloquent about saying how this is important to the clinician, the provider, whoever it is that's interested in integrating this for themselves, and for clinicians, then how it impacts their connection with their patients. But specifically, as we started off the conversation about health professional burnout, the physicians that you interviewed, through all those insights and those interviews, uh, any more insights
Sure.
that our listeners can really grab onto to help themselves in their pursuit of their own well-being?
Well, one insight is if you have a religious tradition that you feel an allegiance to, then draw upon their resources because it's, of course, a deep, deep, deep wisdom.
Yeah.
From a more social science perspective, so we're stepping out of the context of a wisdom tradition, there's a large and growing body of research that speaks to the importance of clearly knowing your core life values and embracing them, which means getting down to the point of actually being able to write them down and describe them to yourself in a way that matters. And then bringing into your daily life reminders of those values.
Yeah.
And so in the social science literature, one of the terms, it's very clunky, is called self-concordance. It's acting in a way that is in harmony with your
Oh,
values.
mhm.
So that begins again with this, I need to know. So it's not just, yeah, I really care about people and I want to bring the best science, but what does it mean for you to really care about people? And how would you articulate that? And what does it mean to bring the best science? So that takes time. It's a deep spiritual practice. It's incredibly rewarding. Uh, but being able to articulate that, again, not necessarily to other people, although you might, and I have shared mine with other people, but it's in a way that I can read it and say, yes, I know what that means. Then the reminders could be a variety of things. I've even gone so far as I have a tattoo on my forearm that illustrates my core values. And so every morning I can look at it and remind myself of them. One of the physicians that we worked with had these subtle reminders in his exam rooms in his office, not something that somebody else might notice, but a painting on the wall, a little statuette in the corner, that he would, when he entered an exam room, there were two that were particularly important to him, that he would see those and he would just take a moment, he'd greet the patient, turn around, because that was an excuse to pause and say, this is how I want to approach the
Mm.
patient on this day. So that idea of self-concordance and acting in harmony with values is really important. But again, as I've said now several times, it requires that we know what they are in a
Yeah.
very specific way.
Yeah.
So I think, and there are some practices that can help people with that. I mean, there are certainly resources out there that can help people with that. But
Yeah.
claiming those yourself is so important.
Yeah, yeah, yeah. So you just mentioned resources. So I always ask about what are some great resources that our listeners who want to learn more about this could either look to those resources for themselves or perhaps in clinical practice with patients.
Well, since I'm not a physician, I don't know a lot about clinical practice, but one of the resources that I think is particularly good, Lisa Miller, who's a researcher, has a book called The Awakened Brain, and that's very much about what science tells us of how our brains are hardwired for spirituality, but she explores it in a way that's, I think, particularly helpful. It's not just the technical side of it, but it's also the human side of it and what that means for expressing it. I mentioned, so that's one resource that I think is really, really helpful. Um, I mentioned appealing to your own wisdom tradition, so there may be resources there. Another book, and now the title of the book, Louise Aronson. Oh, I'll think of it here in a minute. It's about elder care, but it's a beautiful book because, oh golly, yeah, let me see if I can find it. Um,
Well, we can always add it to the description of the podcast later, so no worries. Yeah.
yeah, it was, I think it won the Pulitzer Prize or the National Book Award or something. Elderhood by Louise Aronson. That's it, Elderhood.
Ah, there you go.
So
All
while it's
right.
a lot about a physician's experiences with a population in my age group, 60 and older, it's also really deep in terms of how spirituality, meaning, purpose are a part of healthcare. So that would be a great one. And this is a shameless self-promotion. I have a book coming out next year, so called Lasting Well-Being, a science-based practices for tranquility, authenticity, meaning, and joy. And I cover the whole chapter on meaning and how we integrate that, some practices. So one of the practices, or several of them are around finding your core values and articulating them, and then how do you integrate that more into your daily life? So
Yeah.
I would say the awakened brain to elderhood, and then perhaps my small contribution, lasting
Yes.
well-being.
More than a small contribution. So looking forward to getting a copy myself. So wonderful.
Thank you.
And as we're wrapping up this brief podcast, I am wondering if you feel comfortable sharing how currently you're harnessing meaning, purpose, spirituality for your own well-being.
Sure. I'm trying to practice what I teach. So I have a morning ritual that has been a part of my life for many years that is really, really important. I read poems, and those poems are kind of like a scripture for me. They are, I reflect on them and I think about what they help me understand about my values and how they inspire me. So I have a curated set of poems that I read. Mary Oliver, for example, would be a poet that I would turn to often. I have something in the morning that I read that I consider to be spiritually helpful. So I'm reading Rick Rubin's book now
Huh?
on creativity. It's a deeply spiritual book. So it's really starting my day. And then, as I told you, I remember my core values and touch them on my tattoo to remind myself of those. So that's really important for me. That's how I ground myself each day and try to create a framework going into the day that's important. The thing that's missing for me and that I'm looking for, my wife and I recently moved to Denver, is I need a community of people. I need a
Mm.
community of people with whom I share some of these values. And so I'm looking for places where I might be able to find that community. I'm fortunate enough to have time to volunteer. So volunteering at the local botanic garden. These are places in which I'm likely to find people who share some of my values. And just being in relationship with them and conversation is really important, to learn from them, to be inspired by them. So that's a part of my spirituality that I know is missing. And I think finding that community of individuals with whom you can share your, at least part of your spiritual life is really important. So that's an opportunity for growth for me.
Yeah, absolutely. And of course, from through the lens of a healthy lifestyle, having that social connection will add a lot to your well-being as well.
So it has many benefits. You're so right. You're so right. Yeah.
Very true. Well, thank you so much for joining us for this podcast. And as we close, is there one short key takeaway you would like to have our listeners, yeah, walk away with after this?
I hope I can make this concise. Whatever it takes to grow spiritually, it will be well worth it for yourself and for your ability to do the kind of work that you want. As amorphous as that may be, as loose as it might seem, as much of a journey as it might be, it is well worth it. And so give it a try if you haven't.
I love that. I will follow that advice. Thank you so much again, Matt Bloom. And thank you to our listeners of this GPHI podcast. Please subscribe to our channel and hope to see you on another one of these podcasts in the near future. In the meantime, be safe, be well, and take care. Till next time. Bye bye.